I think so. It's 12:32. We have a fair amount of information, so.
Great. All right, so we'll go ahead and get started. Welcome to the last day of April. Unfortunately, it's still raining out. Well, we wish eventually the sun will come back out and we'll get some nice weather, but you know, it takes time for a while to get there. We're going to walk through a little bit of these slides here shortly. As always, please feel free to start submitting questions into the chat window at any time. That way we have a list of them and we can address them right at the end, and we will answer all of the ones that are in there that we can. I just want to start by saying thank you to everybody for the hard work. I will say, you know, a week or two ago, it wasn't a huge impact on the hospital. We were seeing COVID patients and sick COVID patients, but we weren't seeing the stress on the ICU systems and the ventilator patients and everything that goes along with that. Now that the state's gotten to its top, we're starting to see the impact of that hit the hospitals. It usually trails about 7 to 8 days of the full impact of the hospitals. So we really feel like we're in that peak right now from when the state was there last week. We'll keep monitoring it. Unfortunately, we have had to open up the surge space at both of the community hospitals. I know at Marlborough, we've got a few patients up in the PACU. At Health Alliance, we've opened up our MICU as well as looking to move into the PACU later today. So there's a lot of sick patients out there, and we're working very hard to ensure that they're in a safe environment at our facilities and working with the staff to make sure that you all are safe as we open these units. And what I do want to start with a positive note. John, you can go to the next slide. Today is the first day we get our data back and we're able to announce this. We've actually known it for about 2 weeks, but they put the actual grade in the embargo and we're not allowed to announce it publicly. But today it goes out and all of the scores for all the hospitals around us are out there. And I just want to say we're an A. I appreciate everybody's hard work and commitment to the safety and care they provide to our patients. It makes a difference in these scores. I do think some of these scores are a little quirky. They're not using all of the data that we think is more pertinent and current. But hey, at the end of the day, we scored better than a lot of our peers, and we'll take the A. It's just a testament to the efforts and the skills of the staff at Marlborough Hospital. So I just want to say thank you for that. Now I'm going to turn it over to John, and then we will come back to the questions at the end. Thanks.
All right, great. Thanks, Steve, and thanks everyone for joining us. And I echo Steve, thanking everyone for their continued support and work. I know that it's gotten busy. It's certainly gotten more stressful, and I appreciate everyone showing up and doing their job and working so hard with each other. So thank you. We're going to start off with some good news, and I have a quick one from the pharmacy that I just want to bring up the other day. I'm going to read it. So 2 days ago, Annette Casco, Lisa McCabe, Jason Hyde, and Jennifer Robbins collaborated and facilitated obtaining medication supply for a patient so he could be moved to Boston Hope at 7 at night. Tuesday night, there was some great teamwork done. Lisa went from on her way home, she went to Memorial, then from Leominster. She went to Memorial Hospital from Leominster, and then to Marlborough Hospital with the patient's medications. Also, this patient could be discharged and moved on to Boston Hope. So great news, and just one of many examples that happen every day of the work and teamwork that's being done here. So thanks to that group. This is the slight agenda of what we'll be going over today, and we'll go back and forth this a few times over the course. Next up is an exceptional, grateful comment that I just wanted to share with folks, and this was written in a patient's obituary that was in the paper the other day. And this was a patient that was in the ICU and in the hospital for several days. But the nurse and the ICU was called out specifically here for this. So the family would like to send a warm and grateful thank you to Bill's nurse, Karen, at Memorial Hospital for love and personal care she gave him on his final days. So thank you, Karen. And this is just, I thought, a really emotional and special thing to be called out like this. So great work, just to give folks an idea of the things that are happening here at Marlborough. Some signs and some artwork that's been done on our sideways. This was done by the Girl Scout troop. So they're great pictures. On a kind of a side note, we have all these terrific signs out front of the hospital that say, you're getting there, you're doing a good job, thank you, healthcare are heroes. And someone pointed out to me yesterday that the last sign right in front of the tenting test, where all the cars are lined up waiting to take a left to go get their swab, the final sign says, "You got this." So it's a great sign, but maybe the wrong spot for that sign. So it was pointed out to me by one of the physicians here the other day. So, but great work, and we appreciate all the positive notes, cards, gestures. Thank you. Going to just spend a few minutes going over all the stats, and this is once again comes out every day at 4:30 on the DPH website. Newly reported cases yesterday. So this is yesterday's information that is getting reported out. Was 1,900. We now have peaked 60,000 cases in Massachusetts. Lots of deaths yesterday, 252, and that brings us to a grand total of 3,400 deaths. Percent of all cases currently hospitalized is 6%. Count of cases currently in the ICU, a little over 1,000. New tests reported today, and total tests performed. This is the chart of daily and cumulative confirmed cases. The blue line is the kind of the trend line of where we're going, and the new cases by date. And this chart has it depends on how many tests are getting done each day, who's testing, what kind of folks. So there is some variation in this. Even from hospital to hospital or from region to region, who's getting tested does vary. So there's always going to be a little bit of variation in these numbers, but it does give us a good idea of what's occurring. Number of tests performed by date, and then down here is positive by date. And then this is still something that I look at and pay a lot of attention to. And as you can see, that it overall for the state had been in the high 20s, and over the last several days we've started to see I would call it a downtrend of less than 20%. So the patients that are getting tested, we're seeing less than 20% of them turn up positive. So that's definitely good news, and we anticipate that we'll start seeing that in the coming weeks here at the hospital as well. But right now we're certainly very busy, and this kind of shows the number of patients that have been in the hospital over time. And the top number is kind of the total patients that are hospitalized in Massachusetts with COVID, and the bottom number shows daily variation. This is a fairly new chart that's been getting sent out now daily, and this was as of yesterday. What this shows you is the number of ICU beds that are being utilized in Massachusetts. And the key to point out about this, and we'll just focus on the statewide one, is that 64% of our current ICU beds are in use, and that's only because we're as a state we're doing okay at 64%, is only because so many hospitals, if not every hospital, created additional surge capacity. And if you see that non-surge only, if we had not created the surge beds here at Marlborough Hospital, at the medical center, at St. Vincent's, at Boston, at Mass General, all over the place, we would not have had enough ICU beds. So we can all sit back and think, oh, well, we're doing okay. We still have plenty of ICU beds. It's only because the state, the system, the hospital prepared to make sure that we were prepared for this surge in patients. So this is it's a good news slide in the sense that we have beds, but don't underestimate it. We have a lot of ICU patients in the state. We have more ICU patients at the hospital probably than we ever have, and we have opened up our surge ICU bed, and we've been having 12 plus ICU patients in the hospital for the last several days. It's very busy, and the staff is doing a tremendous job managing this, as well as the ICU physicians. Dr. Robinson and her group are here all night. They're manning the hospital, so lots of teamwork and work is being done to make sure the patients are cared for. This is the daily stats I've showed every week, and just to give you an idea, once again, you can look at this later on, but I'll just go over the highlighted lines. Really, it's a number of inpatient positives. As you can see, the number, if you remember weeks ago, was 5, 6, 7, 8, and you can see how we've really taken a bump. And as of today, we were up to 18 patients, and this number at times been up at 20. It just depends when we take the snapshot, but we've seen a significant increase. You can see the ICU positives on vents, and this number, just 8 days ago was at 3, then 5, then 7, then 8, 9, and So many of these are new patients. The ICU has been doing a great job in getting folks extubated. I believe we've had 2 or 3 folks extubated successfully after being intubated for a long time over the last several days. So really lots of terrific work being done by everyone. But just to show you that this is a significant workload here at the hospital for the staff. We'll point out also the number of COVID-positive employees, that the employees are doing a great job using the PPE, hand washing, not eating in patient carriers, really making sure that they're protecting themselves. We're fortunate that we have had a good amount of PPE, and we're able to get it to our staff, so that it's been working out. That we've had I have an employee health slide later on that I can go over quickly, but overall we've only had 2 patients test positive, so we've been very fortunate. This is the lab slide, so similar to the state's lab information, we track it for Marlborough Hospital. And this is for the month of April, and it lags a day or 2 by getting results updated, so I get it every day at the end of the day. So for it to be fully updated, it just goes, I have 428. But it says you can see negative, positive, and total tests. So you can see that we do a fair amount of testing every day. The weekends are significantly slower with this because our tent volume, particularly on Sunday, is pretty slow. And as of this Sunday, we're actually not going to have tent hours on Sunday, just on Saturday. We've increased our hours a little bit during the week, though, by an hour Monday through Friday to accommodate for more patients to be able to be tested and for ease of use. And those are just to decrease the amount of folks that were waiting to be tested every morning. But you can see that we started off pretty low early on, particularly in March. Then our number, our percentile, increased, specifically dramatically right around the middle of April. And then we've had some ups and downs, and we had a really big day earlier, and what we anticipated, following what you see in the state data, that we'll continue to see a decline in testing. So still lots of positive patients in the Marlborough Hospital area, and a lot of our patients that are coming here for testing are local. They are from Marlborough. They are from Hudson. Some are from Framingham. We don't get a lot of patients from far away. They're not driving from Newton or from Rhode Island to come get tested. They are our patients in our area, which is, I believe, one of the reasons we're seeing the bump in the COVID patients. All right, so I do want to talk about lab testing for just another moment or two. This chart is getting emailed out to everyone today, and the big thing I want to highlight is this box here, and it's a lot clearer in the email. I apologize for this picture. It didn't come out as well as I would have liked it to when I transferred over, but Padma and Dr. Sharma have done some terrific work in helping us create this algorithm around patient testing. So our goal is to have everyone who's admitted to the hospital tested. Unfortunately, right now we don't have enough testing supplies to be able to do that. So while we rolled that out, with our goal of doing that, we're going to redact that a little bit, and we're only going to be able to test the admissions that are going to behavioral health and the patients from nursing homes, as well as anyone that is we suspect of having COVID. But if you're coming in here for an appendicitis, or if you're coming in here with you're getting admitted for a migraine or dehydration, unless you have signs and symptoms of COVID, you won't be getting tested and a screening test for COVID. We do hope to be able to provide that service and that testing when we have enough swabs. But until we have that, we just need to stick to the criteria that is in those 4 boxes. So dialysis patients, there's a mandate for everyone to do that. Lots of facilities require us prior to discharging someone to be tested, so we need to do that. Otherwise, the patients won't leave. But we are testing everyone who is admitted from a nursing home and everyone who's admitted to behavioral health. And the key to that is some of those patients that are in this box here that are screening tests, they do not trigger a PUI. They're just for screening, just so we understand we have a baseline for them, particularly for behavioral health, because there's a very big but behavioral health is an area where they're all walking around. They can be close to each other at times. The behavior around wearing a mask isn't as always compliant as we'd like it to be, and we want to make sure that we don't have someone up there for a week or 10 days that's COVID positive. We want to make sure that if we find someone up there that we can get them, we get them quickly and we can get them isolated. We've actually created 3 COVID positive, 3 rooms that have negative pressure upstairs and a hallway that we can isolate these patients, and I'll talk about that in a moment. The nursing homes, we know, have a lot of COVID in it, so we want to make sure that we're testing them and getting the answer on those patients. So Great work, and more to come, and we'll be around talking about this some more if folks have questions about it. But thank you for everyone's work on this. This is just a quick follow-up on this and how that's done. All behavioral health admissions, all nursing home admissions. This is how the provider orders the test. And the key to that, to make sure it doesn't trigger a PUI, is test only for screening. And the screening-only patients, I just want to reiterate to everyone, do not require PPE. We don't suspect them of having COVID. If we suspect someone of having COVID, they go into a different track and they become a patient under investigation, or as a COVID patient. We don't suspect them of having COVID. We are going to most likely, on occasion, find someone that does that we didn't suspect having COVID. But for the most part, the patients that are getting a screening test, it's like, it would be like getting a screening test prior to having surgery. But we're doing it because we know there's a lot of it in the community, and we're doing our best to capture as much as possible. And we've had meetings with Granger 3 and a town hall this morning. We have a follow-up town hall with the rest of the Granger 3 staff tonight at 6:30. So we've been talking in detail about that. But we're lucky that we're able to provide this level of screening for our behavioral health patients and to assure that we can admit folks and keep everyone safe upstairs. A few other hospital updates. Employee health. I touched on this a moment ago. Employee coronavirus cases remain stable. We've had 2 employees that tested positive. Once returned to work, we have had a total of 35 employees tested for coronavirus here since the start of this. So really good work by everyone wearing your PPE and doing everything that's required. So thank you. And if there's ever things that come up that you'd like to know about, please let us know. We're always interested in making sure that we're doing everything to keep everyone safe as possible, or if there's issues we want to know. We're going to be, and kind of have already, but we have a process now for visitation for CMO patients, and that's regardless if they're COVID or non-COVID. We are working with the nursing supervisors and the case managers to be able to work with the families and the patients to make sure that we can get the folks in here, family, to be able to say goodbye to their loved ones. And that, to me, has been one of the harder things we've had to say no to, is families not being able to say goodbye to their mother or their father that are, dying alone at the hospital. So we've taken a hard look at this and have done some things to make this possible for patients to be able to, have their loved ones at their side, to be able to say goodbye or at their side when they're dying. So lots of great work. Thank you, Joan Davis, for working on this along with the case management team. So this is it's important, and it's part of being a caregiver. So thanks for everyone's support around this. Hospital endo room. So on Granger 1, where same day is, there's an inpatient, where we do all of our endoscopies here at Marlborough Hospital. This is different than the Southborough location, but because endoscopies can generate aerosol treatments, whether it's a colonoscopy or an endoscopy, either end can cause an aerosolization. So we want to make sure that we have a negative pressure room, and definitely for all COVID patients, but particularly until we're able to get enough testing done that we know if someone's COVID or not COVID. So that room has been created. Thanks again to the facility department. The picture below right here is what the room looks like from the inside, and facilities is getting better and better at doing this. And now they've been able to put the fans outside instead of inside, so the window's been taken out. This is a wooden window with a hole here with the hose. I have a follow-up picture in the next slide for this for you. So it's great. It doesn't clog the room up, and it's significantly quieter. I actually right. This is Granger 3. Excuse me. This is not. No, that is well, the Granger 3 and the inpatient endoscopy room look actually very similar. This, I believe, is actually Granger 3 because the endoscopy has a big curtain, but they look the same. I have a few more slides on the following things, so I'm going to go down and continue to talk here. So just so you know, when I say that they've gotten creative, I'm not kidding you. What I am sure of is this isn't, the picture on your left is endoscopy. This is right here, goes into the window, and here is the unit secured under one of the air handlers and plugged in. And it will, run all the time, and, and we may have to find a more permanent fix as this continues and what the regulations come up and what's the requirement around air. But in the meantime, will keep our staff and our patients safe, so great work. Here on the right is a pretty fancy picture and a great setup. This was also done by facilities. This is the Granger 3 rooms, so they look similar as that picture beforehand, and here's the hose going down all the way to the negative air handler. So these are sucking air out of the room. It's going through a HEPA filter and then expelled into the environment. So great work by Mike Williams and his crew. So I'm not going to talk too much about this because we are, as I said, we've had separate meetings, and Katie Masso has done a terrific job working with her staff. But we had a meeting this morning with the Granger 3 staff, and we have another one this evening at 6:30 to talk about this in great detail about placing Granger 3, behavioral health patients with, excuse me. There we go, sorry. Behavioral health patients that have PUIs or end up COVID positive upstairs. So rooms 311, 312, and 313 have been made negative pressure. And there's a door right there so we can keep the entire corridor negative pressure. There's a space for them to walk around. We've worked with telehealth to make sure that they can get seen by the providers through telehealth. They can be consulted. They can participate in groups. We've made accommodations for them to shower, clean, eat. So this has been a super undertaking, and I know it's very nerve-wracking for the staff up there. And I'll keep saying it, that this is really, it's only for patients that are behavioral health. If we suspect them of having COVID and they're medically ill, they're not going to Granger 3. They're going to go then to a medical unit. It's for patients that are behavioral health, have mental illness, that need the behavioral health treatment, but are COVID positive, and we need to put them in a safe environment. So that's been created for this area. The education with the staff has started around PPE, around masking, around donning and doffing. So lots of work's being done here, and it's exciting, and I understand that it's very nerve-wracking. But COVID's not going away, and we need to be able to look at how we can take care of our patients in all the different spaces. And thanks for everyone for your understanding and your help with this. So PPE, this is something we're going to be talking about for I think a very long time. And this is right from the CDC, and this is the equipment that's required to go into a room with a patient that has PUI or COVID. It's a face shield, and in this picture it's an N95, a gown, isolation gown, and a glove, and some gloves. In this picture, it's a face mask. N95 or higher respirators are preferred, but face masks are acceptable. And lots of areas have only used face masks because they haven't had the access to face shields, the N95s. We've been very fortunate with N95s at the system level, and we've been able to use them and get them, and so we've been able to use N95s instead of just face masks. But we continue to have a shortage of different things at different times, and while we're working very hard as a system because all of our supplies come from a system, the medical center, Health Alliance, ourselves, CHL, we all get the same stuff. And right now we've been to have a shortage of the blue gowns, and we've been working hard to get some more, but they're from what I understand that our latest order is stuck at in Boston in customs. But to give everyone an idea, and I'm just going to ask you that question, I don't need an answer, but think about how many blue gowns the system uses a day. The answer is 7,000. So that is a huge number. So even if we get a shipment of 10,000 gowns, it seems like that's a lot, but it's just over a day. A shipment of 50,000 is, what's a week worth? So we just don't. We're going to continue to have a hard time understanding and getting the right amount of PPE, and we have to understand that some things provide a super level of protection, and the blue gown is one of them. It's totally waterproof, but it's also not necessary in all instances. Is that we also have to say, okay, what can we use instead of a blue gown? If we're going into a room where there's a elderly lady having some respiratory, she might be sitting on a non-rebreather, she needs a cup of water. Going in and wearing the yellow gowns that aren't waterproof, or they're water resistant but not waterproof, they're totally acceptable. The guideline for the PPE is around an isolation gown. It doesn't have to be waterproof, and we're going to have to just understand that if you have someone that is full care, that is vomiting, has diarrhea or other issues, then you're going to need a waterproof. You're going to need the blue gown, but we have to make sure that we're not using them when we don't need them, because we're not going to have them any at all. And as things open up in the country, PPE is going to become a bigger issue for us because it's not just the hospitals that are going to be looking for it. It's going to be the restaurants, hair salons, and everyone else along the way that I can't even think of, but pretty much everyone in the world is going to be looking for PPE. So we have to make sure that we're using the correct level of PPE in the correct situations. And I understand that you can think of the yellow gown that it looks thin, it's see-through, but it's going to protect you from getting stuff on you, which is the goal. But it won't protect you, obviously, if there's lots of fluid. Then you need the correct gown for that. So we can answer any questions about that in a few minutes as we get near the end here. But I just wanted to take a minute to talk about it. That an isolation gown doesn't have to be waterproof. It just needs to protect you. But we do need gowns that keep you safe if you're dealing with lots of fluid. Self-monitoring tool. I believe this is my last slide. So we've been taking temperatures and screening everyone since I believe about March 17th to put some of our workforce back to the areas of where they're going to be needed in the workforce, and to make it easier going to the hospital and to have an electronic record. We're going to be moving to the self-monitoring tool. There's going to be a series of emails that have job aids coming out around this for folks to be able to download this onto your phone if you'd like. That's the easiest thing to do. You can download it. We'll send this link out again. I know I spoke to it briefly last week. And then you register, and each day before you come into work, you've got to answer a few questions and basically say that you're not sick, as well as kind of self-monitor your temperature. If you do answer yes that you're feeling sick or to any of the questions, it will flag and it sends an email to employee health, that you will have to follow up on. That you'll get a call and follow up on in making sure that you're not actually sick. It might just have been a typo. But this is something that we're going to need everyone's compliance on. We have to do it. So we'll be asking everyone for 100% compliance when you're coming to work. It's going to tie in with Chronos, so we know that the day that you're here, it will kind of reconcile the report. But I know it's one more thing to ask folks to do, and it should take about I've done it myself. It takes less than 30 seconds. It's very quick. But please do it so we don't have to go chasing after folks, and we want to make sure that we are tracking everyone and making sure that people aren't sick. If you don't want to download it onto your phone, you don't have to. We will have some kiosks and some ways of getting it done on the computer. For the folks that don't have hospital email, which is that's the food services and housekeeping, we will be using paper logs in those two areas for them to keep track of this. I believe I have maybe one or two slides left. I'm going to ask Dr. Sharma to talk about remdesivir here at Marlborough Hospital to give a quick update about that. But this is exciting news. And Dr. Sharma, are you? I just want to make sure you're not muted, or that I can unmute you if you are. Oh, I see you.
Your camera is not enabled. I don't know why.
But
I can just talk.
We can hear you. Go ahead.
Okay. So basically, we've been trying for some time now to get expanded access to this antiviral called remdesivir, which has shown very promising results in some early trials. In fact, there was a trial just resulted yesterday from NIH, which showed positive results with remdesivir. It's made by Gilead, and we have received approval for expanded access to the drug, which is really great news. Another treatment that we can offer to patients going forward. It will take some time, though. It may take up to 2 weeks for us to get all the paperwork together. So we are working hard on that, expediting it as much as possible. I think we are very fortunate that, after a lot of persuasion, Gilead finally did offer us that medication because I believe it really does work well. We had a patient, our first patient, who was intubated for several weeks and then went home extubated, and we had used this drug for a single-use approval that we had gotten. So I'm very excited. And it's really not very many centers have access to this medication. So I think we are very lucky.
All right. Thank you. I'm just going to do one more slide, and then we'll have questions. I know we're a little short on time, but this is an important one. Probably the most important slide we can show you today is that Teresa Canale's last day is tomorrow. She's retiring. She'll be around per diem for a little bit to have some calls with Kathleen, who's taking over for her. But I've had the opportunity to work with Teresa now for just over 5 years, and she's done a terrific job. She's passionate about her job. She's brilliant, very detailed-oriented, and she will be sorely missed from the lab. She's always had some of the highest employee engagement scores. She's done a great job with her staff, and I can't say enough good things about her. And you know, kind of the worst part is when I can't really have a great big party for her to say goodbye. But Teresa, you'll be missed. So thank you, and please stop by to see Teresa before she leaves, as tomorrow is her last day. And so, thank you. Steve, do you want to?
I think we're going to go into questions, right, John?
Yes, I know we're a little bit over, but I have a few minutes.
We're going to go through these relatively quick. The first one was pertaining to the yellow gowns. I think we answered most of that, but are they the same ones that we used to use, John? I believe they are, right?
I don't know if they're identical to the same ones. I know I looked at them closely yesterday with Annette, with Padma. I looked them up on the CDC. They do meet the isolation gowns. There's basically 3 tiers of isolation gowns, how I understand it. And, there's level 1, 2, and 3. These are all level 1, with level 3 being the highest. So they are okay for what we need them for. But as I said, you have to make sure that you're using the right gown for the right situation.
Yeah. The next question is from Susan around Carewell. So anybody, you can go and get the antibody test at Carewell. It's about $100, give or take, and it may or may not be reimbursable by your insurance company. Just want to let everybody know that. Before you go and get it, you should go out to their website to make sure you understand what the test actually provides you for results and what those results mean. But we're not going to go into those in detail here. From Dr. Costigan, a question, John, on the screening of patients coming in and admitted. What about assisted living patients or group home patients?
So I was given pretty clear directions yesterday, and I will clarify, but based on the swabbing, it should only be nursing home patients. But I have a call at 3:30 with a few of the system leaders that I can clarify this just to make sure we're all on the same page. Thank you.
Great. The next one is from Dr. Singla. There's a question about patients coming for urgent or emergency surgery, and if they have no symptoms of COVID, they won't be tested for COVID.
Well,
I think we're just, Sean, I think we're still working through those policies and practices, so I don't think we have a final answer today. We have a discussion this week in general, and then I have a follow-up call on Monday with the medical center to go through their practices so that we can put all the facilities onto one process. So we're working through that, and we'll probably get some better information next week on that. And then we had an idea from Mary about PPE, John. This is actually one that you and I talked about a little bit earlier. A way to prevent waste is where we could reutilize gowns going in between COVID-positive patient rooms. Do you want to talk a little bit about that?
Yeah, Steve and I were just talking about that. Many of you know that my wife's a nurse, and she works at St. Vincent's, and they're given a blue gown at the beginning of their shift, and they're gown off in between shifts. So there are other strategies. So wipe their gown off in between patients, and they leave it hung in the hallway. So there are other strategies that folks are using. So we were going to ask some of these questions about what we can do to reuse some of the current gowns that we have. Clearly, if you go in, if you're wearing a blue gown and you give someone a glass of water who's just sitting in bed, does it really need to be thrown away? While I have my opinion on that, I'm not the expert, but we are going to bring some of these things back because obviously going through 7,000 gowns a day, certainly it makes sense every once in a while. And other ways we can conserve PPE a little bit better. I'll be bringing this and other ideas back, and are we good? There's an opportunity maybe to go to washable gowns as well, but that has some there's some issues around that as well. So this is it's hot on everyone's mind, and certainly we want to make sure people have the right PPE. We're not just saying this is it. We're continuing to investigate it and trying to figure out what we do. So we'll let you know, Mary.
Yeah, and the final question that was out there is around our caregivers and exposures. The data was in there. We've to date had 2 caregivers exposed, so we go up to 3 today, John. 2 caregivers, right?
We have 2 caregivers tested positive. I think we've tested a total of 35, if I remember correctly.
Yeah, and I believe Dr. Scheimer just responded in the comments that none of them have been acquired at the hospital. They've had community exposures, but it doesn't matter. At the end of the day, we still have to keep those employees out to keep everybody else safe. All right, you want to open up the lines, John, in case anybody has a verbal question they want to ask? Or if there's any questions.
Everyone's been warned you're going to be unmuted.
Yeah, when you join the call, it tells you what you're using, I think.
All right. Also, over on the left-hand side, Dave, you see a thing that.
All right. Well, that doesn't seem like I don't know if I'm unmuted. Or let me just.
You and I are good. We just got ours. We remuted everybody because there's a lot of people talking in the background. If you have questions, please just enter them in the chat. And if there aren't any more, I guess we could just wrap up there. Obviously, thank everybody for the hard work and hope the weather was looking good on the weekend and everybody gets a chance to take advantage of it. So,
yep.
So we'll just wait a few seconds to see if there are any other questions that people want to put in.
All right.
All right. Go ahead, John.
Thank you, everyone, once again, for all of your work. Thank you for participating in the meeting and, listening to us. I hope we're giving you all the information we need. And thanks again for all of your work and showing up and doing it. I know it's tough, but thank you.
Thank you.